Thank you, Shahir. Uh, yeah. So hi guys. So today it's the last part of the UKFPO lecture series. I'm just gonna quickly talk about the situational judgment test. It's called the SJT. Everyone who wants to join the foundation, whether you want to join the FY1 or the FY2, you have to sit the SJT. Although it's slightly different for SJT, for FY2 and FY1, I'm just going to mainly focus on SJT for the FY1s. So as it is, it's called a situational judgment test. I'm just going to talk about how to prep, like how I'm prepping for it now. I haven't sat for the exam. I'm sitting in January, but I've done some prep work. I've looked into it. So I hope this is a good way to introduce you guys to it. So every year, again, the UKFPO office will publish an SJT guidance. It's like a 50-page document. It's a PDF. There are a lot of technical details about the exam on this, which I'm not going to talk about because it's all in the book and it's all technical. It's quite dry, but you should know, and you have to know the details of like how to book for the exam, when is the booking period, when is the exam period, and the venue, whether you want to do it in the center, in an Pearson View Center, or you want to do it online, proctored online. So there are a lot of details in this handbook. So when it comes out, you can even have a look at it now, or you can just wait for the 2024 if you're applying for that session. So in a nutshell, SJT is part of a component of where you will go in the UKFPO in FY1. Okay, so the EPM is called an educational performance. I can't remember, but it's something that this is basically what the EPM is how your grade in your medical school, like how well you did in your finals. Yeah, so EPM is educational performance measure. Yeah, so if you are like the best student of all time, you will get the full 50%. And then you will have to sit for the SJT. Maximum you are able to score for the SJT is 50, and you add them both together, it will determine how good your score is, and that will put you in the ranks of competing with everyone that's applying to the UKFPO. So EPM, it's all based on what you did in med school. So you can't change anything now at this current point if you are already applying, because it means you've already graduated, you have your transcript already. But what you can change is your SJT. You still have 50% chance. So try and do your best. Get the highest score possible. Start early and prepare so that you are more likely to get where you will go. So yeah. Some of the difficulties of SJT that I've been looking around and talking as also with Dr. Shaheer, who sat for the SJT for FY2, is actually the timing, because the STEM is long. You have to read like a long scenario, right? And then they will give you like very similar options which are like somewhat appropriate or somewhat inappropriate, and you have to rank them or select them. You see, and this might eat into the timing, so you have a very short time for each stem, for you to read each stem. Like you have to just look at it, okay, that's the answer, and just move on. So practicing doing the SJT, be familiar with how the GMC thinks and what GMC expects of a FY1 doctor is very important, and that's why we have a few documents to look at later. Also, one of the difficulties of the SJT is sometimes it can be vague, so it will cause some students to overanalyze the situation and also assuming too much. If it doesn't say it's not that, if it doesn't state in the question, don't assume anything new. Just take it as it is in the printed paper or on the question that's about it. Don't dwell and overanalyze and start trying to tear everything apart. You don't have the time, and you shouldn't do that, because you will start doing other things and selecting the wrong answer. Okay, and sometimes because the SJT appears to be a non-academic exam, some might just brush it aside and say, oh, it's just an aptitude test, I can do it, it's just common sense. I don't agree that statement. It is not just common sense. The problem is we all come from different backgrounds. We do not grow up in a GMC environment. So you do have to know and be familiar with how the GMC thinks. So definitely you should read and look into how the GMC expects of a doctor. There is a document that we can look at afterwards. So in a nutshell, the format of the SJT, I'm not going to dwell into how many types, how much one question gives you how many marks and whatnot. Basically, 70 questions, 150 minutes, and you have 2.14 minutes per question. So, but that includes reading, looking at your options, and deciding what you want to do. It's not really that long, but it's definitely doable. So it comes with practice and being familiar with what the GMC wants of you. So there are 3 parts. Part 1 would be what we call rating questions, 450 marks. Part 2 is multiple choice, 240 marks. And ranking, being the bulk of all the marks, is 740 marks. So yeah. So I'm just going to go into part 1. I've taken this from the SJT 2023 practice questions. This is part 1, rating. Yep. So as you can see, this is just a sample of how it would look like. So you have been working in the acute admissions unit for the past 4 months, and the patient has been admitted for severe abdominal pain. This is the 3rd time that the patient has been admitted for the same condition, and you have conducted all her previous assessments. You go and assess the patient, when she sees you, she says, "No, I do not want you as my doctor again. You can't find out what is wrong with me. Please go and get me another doctor." Okay, so it would ask you, because it's a rating question, they will say, rate the appropriateness of the following responses to say in this situation. Okay, assume they are all said in a polite way. So 1 being very appropriate and 4 being inappropriate at all. So what are the in-betweens? The in-betweens, like 1 is very appropriate, 2 is somewhat inappropriate. 2 is somewhat appropriate. This is an error. And 3 is somewhat inappropriate. I'll change this before I send it out to you guys. And 4 is inappropriate. Okay. So I've given the numbers in red are correct. It's just that ignore the words behind. I will send out the corrected version later on. Okay, so you have to rate A. Please be assured that I will try my best to find out the cause of your pain. So it's very obvious. It's very appropriate. So B, I'm here to help you. Please don't speak to me in that way. It is somewhat inappropriate because it seems that you are like chiding the patient. Okay, C, let me see if a senior doctor is available to assess you instead. Is somewhat appropriate. Ignore, it's not inappropriate. It is appropriate, somewhat appropriate. It is your job to assess the patient, but since the patient has said that she does not want you, you can try to see, but it's not the most appropriate thing to do, but it's somewhat appropriate. So, okay. D, I'm sorry you feel that way, but it is not my fault you're experiencing pain. Again, it is somewhat inappropriate. This should be inappropriate, number 4. Okay, because you are putting the blame on the patient and saying that it's not my fault that you're experiencing pain. Okay, and then E, I can see if a senior doctor is available. However, you might end up having to wait for a while to be seen. Yeah. So this is definitely somewhat appropriate because you are trying to help her, but at the same time, you as a junior doctor, you should also be able to assess her, but you are trying to help her, but it's not the most appropriate thing of all of this, right? So yeah, I will edit this. So I apologize for the blunder in the answers. This question can be found on the UKFPO website in the SJT page if you would like to have a look at it. So that's just a very brief introduction to the rating questions. There are 3 types of rating questions. Number 1, as we have seen, is rate the appropriateness of the actions. So 1 being very appropriate, then somewhat appropriate, 3 somewhat inappropriate, and 4 appropriate. Then the second type of the rating questions would be rate the importance of considerations. One being very important, two important, three of minor importance, and four not important at all. And the third type is the appropriateness of responses to say, like this is what we did in the last question. One being very appropriate, two somewhat appropriate, three somewhat inappropriate, and four inappropriate. Like, how do you decide when to use somewhat appropriate and somewhat inappropriate? I don't think I'm the best person to explain this, but there is a link later on, which the doctor is a very senior examiner for the SJT. He would explain it much better. So I'll leave the link for you so that you guys can have a look. So part 2, okay, multiple choice question. So you are to choose 3 out of all the 8 options here. You are supposed to choose 3. Do not choose more because you will lose all your marks even though your 3 out of your 4 selection is correct. You can only choose 3. Okay, so the stem would be, whilst working on a surgery rotation, your consultant asks you to prescribe a high dose of warfarin for a patient to go home with. However, the pharmacist informs you that the hospital protocol advises to use a smaller dose of warfarin to begin with to reduce the risk of serious hemorrhage. You have only recently started working with your consultant, but your FY1 colleagues have told you that she often gets angry when her decisions are challenged. So choose the 3 most appropriate actions to take in this situation. So again, as you can see, you have 2.14 minutes per question, and you have to read this, you have to read all of this, and then you have to decide which 3 is the most appropriate to select. So 2.14 minutes is quite a short time to do all of this. So I've given you the answer here. It's C, F, and H. So let's just look at C. Ask your consultant if she wants you to change the prescription to a smaller dose. Ask the pharmacist to contact your consultant to discuss the dosage directly with her, and ask your consultant to explain why she prescribed such a high dose of warfarin. So these 3 answers, when you put them together, it's one cohesive story and it makes sense even when they are put together. So part 2, what is expected in part 2 is your answers when put together, 3 of them when it's put together, it must make sense. It should not make sense. Yeah. So yeah. So the correct answer is C, F, and H. Okay. This again is taken from the practice paper, SJT practice paper from the UKFPO for 2023. The rationale is there as well. So answers are taken together. Choose 3 out of the 8 options. And then when the 3 answers you select should make sense when they are all put together. Okay. So how do they mark is if you get 3 out of 3 correct, you get 12 marks, which is the maximum mark per MCQ question. If you get 2 out of 3, fret not, you still get 8 marks. And if you get 1 out of 3 correct, you still get 4 marks. Okay, so there's no negative marking, but at least even if you select 1 right, 2 right, you still get marks for it. It's not like if you don't get the correct combination, it's 0 totally. Okay, so like I said, if you select more than 4, it means you did not follow the instruction. You totally just get 0 marks. So please don't select 4, just select 3. So again, there are 3 types of MCQ questions. So, yep. 3, yep. So ignore the 3. So number 1, you have to select the 3 most appropriate actions to take in the scenario. So select 3 out of 8 most appropriate actions to take in the scenario. The second type of MCQ question would be select 3 most important consideration in the management of this scenario. And the third would be select the 3 most appropriate responses to say in this situation. So it's always action, consideration, and responses. Even for the rating, the part 1, the rating question, it's also actions, consideration, and responses to say. So yeah. Part 3, the last and the heaviest bulk of the marks will come from part 3. It's called ranking questions. So an example of this type of question would be, you are on a busy medical rotation. One of your FY1 colleagues confides in you that he's finding the job particularly difficult. He tells you that he feels stressed and he's not sleeping well. He tells you that he's so tired and that he's worried he will make a mistake. He tells you that he's considering taking time off work to recover and asks for your advice. Okay, so the task is to rank in order the importance of the following considerations in the management of this situation, 1 being most important and 5 being least important. So each option A, B, C, D, E, F, you each have to give a number ranking its importance, okay? So I've given the answer here as well. The rationale can be found in the UKFPO website, SJT Answers with Rationale. It's a big document. They will explain each and every option, why is the right one and why is not the right one. So in ranking question, basically, you rank which is the most important and which is the least important of each, okay? So C, the order that's the most ideal in the GMC's mind is CADEB. Okay. C is, of course, the most important. So the impact on patient safety if he's working while tired, the most important one. A, the health and well-being of your colleague is the second, number 2. D, the impact on the team if he takes time work, of course, that's also important, but that's number 3. E, the impact on your workload if he takes time work is getting more least important, okay? And last but not least, the opportunity for financial gain by working extra shift if he takes time off work. That is totally least important in this situation, whether he takes time off or not, okay? So this is how you rank it. So in this kind of question, you have to think what you should do as a NHS GMC approved FY1 doctor, not what you would do. Yep. So what they want is ideal answers. And there is a best order of answers like this. This is given by the UKFPO office. In this scenario, the best answer is CADEB. C being the most important and B being the least important. You might not agree with it, but you must learn how the GMC wants you to answer it. Okay. That's why it's what you should do and not what you would do. Okay. So if you get all of it in the correct order, okay, you will get maximum marks, which is 20. Okay. And the closer your answer is to the model answer, the higher your score. Again, even though if you get 2 or 3 rankings incorrect, you still get marks for the answers that are ranked in the correct order. Okay, assuming it's CADEB and you did CAED and B. So you will not get marks for the D and E because the position has been switched, right? But you still get marks for C, A, and B because it's in the correct order as in the model answers. So again, there are 3 types of ranking question. Same with rating and MCQ. It's rank appropriateness of actions, importance of considerations, and appropriateness of responses to say. So it's the same thing, actions, considerations, and responses to say. Okay. These are some of the areas that are specifically stated that they will test. Patient focus. Are you able to cope with pressure? Effective communication skill, commitment to professionalism, and team working. Okay, these are the areas that they test. Yeah, there are 3 resources on the official UKFPO website. I've put the screenshot here and the link here for you guys as well. So the first one that I've highlighted in red, this is a link to the Pearson View website. Okay, this only has if you're taking, if you click on this website, it will lead you to Pearson VUE website, and you can click on a link, which I'll show you afterwards, where you can take a mock exam, which is the same as how you would take it on the exam day. Like, it gets you familiarized with the platform, okay, with the way how you answer, because it's no longer pen and paper. Pen and paper is quite simple, but now you are doing it on a computer. Whether you do it in a center or you do it at home, you have to go to the Pearson VUE platform and key in your answers there. So the Pearson VUE provides you with with an actual mock paper in the actual exam format and layout in the PC that you can try and familiarize yourself. I highly recommend that you do it. Get familiarized with the system, when is next, back, review, exit, and whatnot. Okay. Unfortunately, the mock exam on Pearson VUE's website doesn't have answers or rationale with it. You just know, they will just give you the question, you just try to answer it, and that's about it. Okay. And then there are the official UKFPO practice papers for 2023. So one is just a question and one is the one with answers. They are the same question, it's just that one is with answers and one is without. This is the official practice papers. And then you have past practice paper. This is from UKFPO 2019 and 2018, I think. So same thing, questions, practice paper 1, question, answers, practice paper 2, question and answers. So officially you get 3 papers with rationale from the UKFPO. So it's this, the second box, and the third box you get 2. These are the official resources, and you get one more extra, but it's without answers in the Pearson VUE website. Every year there's only these 3 resources. So there are other courses, of course. I haven't tried them out. I don't intend to as well. I'm just going to look at YouTube. There are quite a few reputable YouTube, which I will share with you later on. So this is the Pearson VUE website. Okay, if you click on the Pearson VUE, the first link over here, you get the Pearson VUE website here. So, yep. So you can see there's a UKFP practice paper F1. Okay, this brings you to the portal for the exam, which you can do a mock run of the exam as it is on the exam day on the computer. But there will be no answers or rationale given. You're just going to do the paper and just familiarize yourself with it. In the meantime, of course, you think about how you want to approach this and whatnot. Okay. So here are some of my resources, which also Dr. Shaheer has so kindly shared with me, as he has taken the he has taken the SJT for FY2 last year, and he scored really well. So thank you, Dr. Shaheer, as well. So again, UKFPO practice papers. There are 3 official practice papers. Yep, and 1 mock paper, which does not contain the answers. Okay. Then you have this thing called the GMC Good Medical Practice. You must read it at least once. Please just read it. To be honest, it's not really that helpful. It's just mainly common sense. But please just read it. You might learn something new. I did learn a few new things. It's not a very long document. Please read it. This is a very important document because this is how they write the SJT question according to that document. GMC in Action website, I will show it to you in a while. IMG Marvels SJT. This is a group of FY students who successfully passed the SJT, and they made a playlist of YouTube videos about how they studied for it and how you should do it. It's all the tips and tricks that that they actually went through the exam. Meanwhile, I have not. So I will try to make a follow-up video once I've taken the exam and see how well I did and see what resources I can add to it. So last but not least is this eMedica SJT YouTube video. eMedica is run by Dr. Mahibur, I think his name is. He's a very experienced SJT examiner. He has some free videos on YouTube which are absolutely useful, absolutely very good. You should definitely look at it. Because he's an examiner, he can explain to you the rationale behind each and every stem, why it's good, why it's not good, why is it appropriate. It's very good. The YouTube are free, but his course or e-medical SJT course is not free. I think it's £99 for a month. Of course, there are more information than what he posted on YouTube. YouTube are like free stuff, like there's only one question, but do look at it. He will tell you more about the SJT in much more detail than I can. Okay. So this is the GMC in action website. Uh, they have so kindly, the GMC have so kindly made this website to discuss in a very interactive way about ethical problems. So there are some scenarios like, what if you treat a patient and then the patient asks you if you could go out for dinner with them? So it lets you play with, it's kind of like a little game that you can play about ethical issues. So it's an interactive website about ethical issues and how the GMC expects a doctor to behave in those scenarios. There are a lot. It's quite fun. It's not boring. So do check it out, and hopefully this will help you. So this is the end of the UKFPO lecture series. I hope the YouTube videos, we'll upload this on the YouTube, and hope this will be of help to future RCSI students. And if you guys have anything you want to email, this is my email address. So yeah, thank you guys. And thank you, Dr. Shaheer, for everything.